management. And today we're going to be sharing some very insightful tips on how you can use your cultural foods to improve diabetes and also to support your gut health. All right. So if you're watching us on the replay, please go ahead and hashtag replay, and also feel free to share this live. All right. All right. So let's get into it. All right. Do you want to share anything first, Shannon?
Yeah. Well, first I want to talk about a little bit off topic how we met. So Abby and I, it seems like forever ago, Abby and I, we attended the same graduate program in New York City to become registered dietitians. And people in the field, we know that those supervised practices are like gold.
Absolutely. Yeah.
They're not accepting many. It's a lot of competition, and she and I happened to make it in the Graduate School of Public Health and Health Policy here in New York.
Yeah.
And we just connected. And so we talk to each other regularly just to catch up on life and, see how it's going. And she happens to be one of my favorite dietitians as well.
Thank you. Thank you. I really appreciate it.
Yes. So I just wanted to plug that in, like, how we know each other. It's been a few years at this point.
Yeah, absolutely.
So now we're connecting more professionally.
Yeah,
we're well within our fields at this point. So
absolutely. Yeah. And to add, the last time I checked, Black dietitians, we're only 2.7% out of the many.
2.7%. It might have gone up a little bit, maybe 2.8, 2.9, but either way, that is a negligible amount of Black dietitians in the United States.
Exactly.
We know that, the population is very diverse. So
very, very diverse. And the thing too, when you take a look at statistics and when it comes to Black women and chronic disease, it's very high. Absolutely. So we're here to provide support, to provide guidance, to help reduce the chronic diseases. Mm-hmm. A lot of chronic diseases can be managed, can be reversed with diet and lifestyle modification, lifestyle changes.
Yes. In addition to
100%.
Sometimes we just do need medication as well.
Yeah,
like
absolutely.
Whether it's genetics or things like that. Medication is not a bad thing. Mm-hmm. But however, we know very well that diet and lifestyle intervention helps tremendously in either eliminating medication or reducing the amount of medication that someone has to make.
Absolutely, absolutely. And by making smaller changes, I've worked with clients, and by just making small changes within a short period of time, they see significant improvement. And I'm sure you can testify to that too.
Yes, I can. Yep. Yeah. And support, I want to note that support is a key component of that, because just giving someone information, like whether you're giving them handouts or just verbally giving them information, is just a small piece of what someone needs to make behavior change. That support, where we come in, that emotional support, we're people's cheerleaders, and that is a huge component of someone taking control of their health too.
Absolutely. And the guidance on a regular basis.
Regular check-ins, maybe you had a not so good week, and that's okay. But what do we have to do? Let's pivot. What do we have to look at differently to make next week a little bit better?
Absolutely. And just to add, we do accept insurance. We do work with some major insurance companies. We also do work with Medicare. You work with Medicare, right?
Yeah. I work with Medicare. I do. Yeah.
Just to put that out there. So if anyone is struggling with diabetes or need weight support or struggling with gut health, just want to make that noted. All right. So let's talk a little bit about diabetes. Okay,
Yeah.
so in your practice, right, what's the biggest challenge do you see your clients are struggling with on a regular basis?
I would say the biggest challenge is acceptance. And if you have a diabetes diagnosis, a new diabetes specifically diagnosis, it can be hard to accept that this is something new that you have to pay attention to in order to maintain your overall health. So whether it's doing your finger pricks, whether it's keeping up with your medical appointments, paying a little closer attention to what you're eating, that acceptance part can be really hard for some people. You know, as far as maybe changing up a little bit of their daily regimen of making it a priority.
Right. So what you said, you mentioned finger pricks.
Yes. So
How often
check
do
your
you,
blood.
yeah, right. How often do you recommend individuals get their finger prick done?
Yeah, it all depends. I know for some individuals, and we also, the dietitian works in conjunction with the doctor usually, or the nurse practitioner, or whoever it is. So for some people, it's like once a week. For other people, it might be 3 times
Yeah.
daily. And for those individuals where it's a little more often, it's usually they're fasting, meaning when they wake up first thing in the morning, and then 1 to 2 hours after a meal. So that can easily be maybe 3 to 4 times a day that you have to prick your finger and get like a little drop of blood into your glucometer to see, you know, what your trends are. But
Okay.
there's also improvement in technology, and we have something called CGMs now,
Yeah.
continuous glucose monitors. So it's like a very small device. They make such great improvements with technology, and it's tiny, but you basically wear it on your body. And so some people, you might see people with it on their arm or other places, and that will allow you to maybe eliminate altogether or just decrease the amount of times you have to prick your finger.
Right. Sounds good. And just to add, the CGM, not only individual with diabetes wears them or can get benefit from them. All right.
Yeah, that's true.
Yeah.
That's true. If you just want to see how certain foods affect your blood sugar, or maybe even how stress affects you, maybe certain times of the month, if you're a woman, you know, when you're on your menstrual cycle, what is your blood sugar? There are multiple things that can affect your blood sugar other than just food. So
Absolutely.
that CGM can be beneficial for a lot of people.
Absolutely. Also, what's the biggest misconception are you seeing with your clients when it comes to carbs?
Yeah,
Because you know, a lot
I
of
was
people
actually
have
going to
the
say,
love.
the biggest misconception is giving up a certain whole food group. And I just think that's kind of crazy. Because it's not about giving up a whole food group, and it's about what are we adding so that we can maybe reduce other things. But to say you can never have rice or you can never have bread, I just think that is not that's not sustainable.
Absolutely. And you know
Yeah.
what? Let me just add a little gut friendly tip
Yeah.
in it while we on carbs. Like I like to bring out my
Oh, I love that.
so yeah, I'll bring out my green
Wait, we
plantains.
didn't mention we are from the Caribbean. So when we see things like that, we get very
Yeah,
excited.
we get excited because you know
Yes. I
it's
love
there.
it. But go and say what you were
Yeah.
saying. I didn't mean to get so
So
excited,
actually,
but
no,
yeah.
no, I get it. I get excited too when I see my coconuts and my mangoes, and
Yes.
yeah, yeah, get very excited. All
Yes.
right. So when it comes to you know, diabetes, gut health, these complex carbs are very important.
Mm-hmm.
Um, it's good to add close. I like to say add close to your carbs. You never want to eat any naked carbs. You want to always add close to it. What I mean by that is always pairing your carbs with a healthy fat or a mix of fats and protein like nuts or carbs with cheese or something of the sort. Just always combine your carbs with fats and protein to keep your blood sugar nice and stable. In addition, when it comes to, you know, cultural foods such as the green plantain, the green banana, it's very rich in prebiotic fiber
Mm.
that's helped to support gut health. right? And the good thing about, the good thing about green plantains, green banana, when I was little, I usually dislike eating the green banana or the green plantain when it's boiled and then it gets hard. But I didn't understand that there's benefit from that. So when you cook the green banana, don't eat it hot, eat it last. So eat your protein or your veggies first. Let it cool down and get hard. Because
why is that, Abby?
right?
Why should they wait?
So the magic happens when it gets hard, because it developed this thing called resistant starch, right? And the thing is, when you eat the plantain, the green plantain, or even the potato, or even the rice, or the green banana, when you allow it to cool down, it develops the resistant starch. And guess what happened? When your bacteria in your colon, your body don't absorb all the resistant starch. Your body cannot, once the carbs is converted to resistant starch, your body cannot absorb it. So that's food for your gut microbiome, for your gut bacteria. So when it goes down, when the resistant starch goes down into your colon, that's fuel for them, that's food for them. They convert it into this magic chemical called short chain fatty acids.
Yes.
Right. And those are like powerful chemicals that helps to reduce inflammation. And as you may or may not know, guys out there, diabetes is related to inflammation.
Yeah.
Right.
Yes.
So, right. So when you consume carbs, prebiotic, that is rich in prebiotic fiber, is very helpful to your body. So don't be afraid. Don't think that, okay, I cannot eat carbs because it's going to send my blood sugar sky high. You do need carbs. You even need carbs for kidney function.
Yes.
All right.
You need carbs for energy, just simple energy. You're not going to be able to focus or think the same or go about your daily errands the same way if you don't have carbohydrate.
Exactly.
So carbohydrate is actually vital. It's our body's preferred source of fuel.
Main
so
source.
We need yes, it's our preferred source and our main source of fuel. So we want to make sure we're focusing on the quality of the carbohydrate. So like you said, complex starches, that was a beautiful example with the root vegetable. So things like that, whether it's like plantain or sweet potato, the potato that you had. In the Caribbean, there's things like cassava, yuca, dasheen, a lot of different, just beautiful complex carbohydrates. And then there's other things too. There's whole wheat bread, multi-grain bread. There is wild rice, brown rice. When we're looking at our pastas, we could maybe do little swaps, like choosing a whole wheat pasta, which has more fiber. And fiber is very important for blood sugar as well, because it will help to blunt that blood sugar spike. So instead of it going higher, the fiber as well as the protein will make it go a little bit lower. And it will also, instead of keeping it higher, it'll let it go down faster. So fiber, the complex carbs are very important for blood sugar management as well as gut health, as you were saying.
Absolutely. Absolutely. So besides, say, dietary changes, what other intervention can help to improve diabetes?
I would say, besides dietary changes, paying a little bit closer attention to physical activity, because if you're able to, of course, because physical activity is known to naturally lower blood sugar. And the general recommendation for most adults is 150 minutes of moderate intensity physical activity per week. That equates to about 2.5 hours of physical activity per week. So it should be doable for most people. And it will allow your blood glucose to go from just sitting in your bloodstream to go into your cells to be used for energy. So it's very effective to try to increase your physical activity whenever possible for that blood sugar management. Also, to paying attention to water, something as simple as water, because water also naturally lowers your blood sugar. paying attention, paying attention to your stress levels. So finding ways to de-stress, having an outlet, because stress increases cortisol, which I know you talk a lot about as well. And that affects our blood sugar very negatively. And then lastly, sleep. If we're not getting enough sleep, we're going to cause our hormones to go out of whack. We're going to be hungrier, and we're going to tend to choose foods that are less nutrient dense and probably higher in sugar. So all of those things are interrelated. It's so much bigger than just food when it comes to blood sugar management.
Absolutely. And just let's hop back to the exercise. So it's recommended, if possible, right after you eat, like say even like 15 minutes after your meal. It's very important if you could take a 10-15 minutes walk to help to, you know,
digestion, your blood sugar. It can help your bowel movements to be more regular. If you are able to do a 15-minute walk, it can be really powerful, and it's so simple.
So simple.
But we have to be intentional about it.
Absolutely. And then you also mentioned about sleep. And I've experienced with clients that they go to the gym, I would say 4 to 5 days a week, sometimes 6 days a week. They eat very well, but they lack sleep because of work.
Right.
So that as a result, their blood glucose was sky high.
Yeah.
And just by making the simple change of getting into bed at night, that client was able to reduce or reverse their high glucose, because they weren't
they weren't necessarily diabetic.
They weren't diabetic, but if they
continue that trend,
exactly,
they could easily
exactly. And I've even other clients with lack of adequate sleep, you know, they struggle with what you call it, with high blood glucose levels. So sleep is very important. Sleep, even for gut health.
Yeah.
Sleep is super important.
I was going to ask you, what is the biggest misconception about gut health?
So when it comes to the biggest misconception, one of them is that you know, probiotic is the fix for all gut issues. Also that gut issues is only related to, say, bloating and constipation. But gut health, good gut health is the core of all health. All right. Gut health, if your gut is out of whack, it will affect your joint, your immune system, your hormones, your brain function. Gut health is the core of all health. All right. 70% of our immune cells resides in our gut.
Powerful. Wow.
90% of our hormones, or happy hormones, neurotransmitter, serotonin, dopamine, they're produced in our gut. So if your gut is out of whack, your hormone is going to be out of balance.
Yeah. Wow.
So that's very important. If your gut is out of whack, you're going to have a lot of joint pain, aches and pain. You know, if your gut is out of whack, most likely you'll have skin issues. So you're working on your gut health is very important. Also, if you're diabetic and you work on improving your gut health, that can help you to become more, your insulin to become more sensitive. So your body better able to manage, to utilize, you know, glucose, and that will result in less spikes in your blood sugar levels, less crashes, more energy, less fatigue.
Yeah, I'm so glad you brought up insulin sensitivity, because I want to touch on that for a second. So the physical activity also plays a huge role in increasing our insulin sensitivity. And there's a lot of individuals, specifically diabetics, who are insulin resistant. And it can be so disheartening that, you know, your body is producing all this insulin, but you're resistant to it. And that can also cause unwanted weight gain, because we know that insulin is an anabolic hormone, meaning that causes us to put on weight. So if you're producing all this insulin and you're resistant to it, you're gaining weight, you're not improving your blood sugar numbers. So things like walking, simply walking, or any type of physical activity can drastically improve your insulin sensitivity, therefore causing your body to use it more efficiently. So I'm really glad you brought that up too.
Sounds good. And then just to add, if you like to eat your carbs, eat it around close to when you're going to exercise. So your body is going to utilize the carbs as energy for your muscles when you exercise.
Exactly.
So, don't be afraid that, okay, I cannot eat carbs. You can eat carbs, but eat most of your carbs during the time or close to the time when you're going to exercise. So you get the benefits of, you have the energy and you're still eating the foods that you love.
You enjoy. Yeah. And let's go ahead and dive a little bit into the more specific pieces of cultural foods. Like today we're talking specifically about African American and Caribbean cuisine, but we'll definitely have other conversations about different cultures, which are just as important. So I wanted to dive into that.
Okay.
So because some people, especially if they do meet with a dietitian who's not necessarily culturally sensitive, they feel as though, oh, I have to go home and start eating salads, and I hate salad. And I met with people and told them, if you don't like salad, you never have to eat a salad a day in your life. Right. So yeah, I wanted to touch on that. And maybe you can start off by telling us, like, what are some different food groups in African American Caribbean culture that that are just as healthy as having a salad with a chicken breast on top?
So the thing is, it's the food combination and the timing is very important when it comes to diabetes. All whole foods are important. Yes. It's the amount. It's just the amount. I will never tell, or an individual with diabetes should never have to eliminate any food group, period. Yeah. It's just the amount. So for example, if you're someone that usually say eat a cup of rice, now you're diabetic, okay, maybe you could decrease it to half a cup of rice. But choosing, and to be honest, if you like white rice, fine, you can have your white rice, just pair it with some beans at the side, pair it with beans on the side. So you'll have your fiber to help manage your blood sugar levels. So when you're eating your meals, your cultural meals, just make sure that when you have your plate, just make sure half your plate have your veggies, your non-starchy vegetables with your fiber. And then you have your carbs and your protein on this other side.
Yeah, absolutely.
Yeah, so you can have any carbs from your cultural food groups that you like, whether it be the yuca or cassava, whether it's
that's a starch. Yeah, right.
Starch. That's the starch. Whether it's the the sheen. But as I mentioned earlier, make these carbs cool down so it builds up the resistant starch. And remember, when your body when the food develops the resistant starch, your body will not absorb all the carbs from it. It will go in your colon, and your bacteria will be happy with that, because that's their preferred food. That's the fuel that they need. All right.
Right.
What else?
I can add to that too. So there's something called the Caribbean Food Group Guide, also known as the multi-mix principle. And it's not too well known, but I found it to be very helpful, specifically for individuals who consume their meals together, their meal components mixed up and together. And so the concept with that is to try to consume 4 groups out of the 6 known groups in Caribbean culture. So I'm going to name them. So fats. So that can be things like vegetable oils. It can be coconut oil. Then we have food from animals, such as meat, eggs, what else? Milk. We also have fruits. So it can be papaya, mango, jackfruit, plums. Then there's the staple foods, one of which you had held up before. So it can be, yeah, those are staple foods in the Caribbean. So that's going to be things like your green banana, your cassava, even cornmeal. And the fifth one is, if you're not a meat eater, or if you don't like to eat meat derived products, that's fine. But you can do more legumes, nuts, and seeds in order for you to get your protein. And then the last item is the dark green leafy vegetables. So that's going to be like your callaloo, your collard greens, your okra. So things like that. So if you choose 4 out of the 6, it'll also help you to get that balanced meal, such as like the plate method that you were describing.
Yeah.
As well.
Absolutely. And another thing to keep in mind, so if you're diabetic, instead of baking your sweet potato, it's better to boil it, because when you boil it, the glycemic index is less versus when you bake it. So that's another quick tip.
Wow. So boiling will reduce that glycemic index.
So
for the
boiling will reduce the glycemic index. And I'm assuming it's the same thing for like ripe plantain. So some people will bake ripe plantain, right? Yeah, bake the ripe plantain. So it's better to boil the ripe plantain, your sweet potato, instead of baking them.
Got
it. The glycemic index will be less.
Tip. Okay, good. Yeah.
Yeah.
And I wanted to touch on collard greens very quickly. Collard greens are actually a powerhouse vegetable. More research is coming out about it. I recently saw that it actually boasts about 270 milligrams of calcium. And it's known to be the best vegetable for bone health, which is amazing.
Yeah.
Yeah, and it's been cultural cuisines, specifically African American and Caribbean cuisines for centuries.
Absolutely. Yeah. So the thing is, when a lot of people think about calcium, they think about milk.
Yes, and there's calcium in so many other foods. Yeah.
But green vegetables, such as your broccoli, your callaloo, you know, the collard greens, they're rich source of calcium.
Yeah.
So calcium is not only from milk.
That's right.
You can get it from your green veggies.
That's right. And the collard greens also have vitamin K.
Yeah.
Which is important for calcium regulation as
well. Exactly.
So these cultural foods are so rich, and it's such a misnomer that it has to be eliminated or reduced. Like, we really want to turn that on its head and let people know that, no, eat your cultural foods. You just have to know how to do it more healthfully. Yeah.
Absolutely. It's just about making some changes, making a little tweak to it.
Exactly.
That's it.
Yeah.
That's it. Your cultural food is as healthy as any other.
It truly is. Yeah, sometimes even more. So yeah, I think that pretty much concludes our live today. If someone is looking for, gut health support or some of the other services that you do offer that you mentioned at the top of the video, how can they get in contact with you?
I am at therootdietitian.com. I am also on Instagram at The Root Dietitian, and TikTok at The Root Dietitian. Nice. So you can find me there, or you can find me on my page, Abby Walker, on Facebook.
Wonderful. And if anyone is looking for help with diabetes management, prediabetes, weight, or pregnancy postpartum, for individual counseling, I can be found at www.nutrish.net. It's spelled Nutrished, but it's spelled pronounced Nutrish. And on social media, I am at nutrish.nutrition. So that's Instagram, fan base, YouTube. It's nutrish.nutrition.
All right, sounds good. So if anyone is on the live and have any questions, feel free to drop it in the chat.
Drop it in the chat.
Now,
question.
Yeah, we'll definitely answer it now, or we come back and answer it. Feel free. If anyone need any support when it comes to diabetes or gut health or weight management, feel free to reach out. As we mentioned earlier, we also do accept major insurance such as Sigma, United Health, Aetna,
Medicare,
Medicare, $11.99.
Yeah. Yes, we are in network with a plethora of healthcare providers.
Exactly.
And Abby is a certified personal trainer.
Thanks
all
for
around
adding.
Okay, so
yeah.
you need it. We have it here.
We have you covered.
We are here to support you.
Yeah.
And we look forward to future conversations to enlighten you.
Definitely. So if you're watching this video on the replay, please go ahead and hashtag replay. Leave us a like. Leave us a comment. Let us know where you're tuning from. All right.
Yes. All right. Take care. Until next time, everybody.
All right. Bye-bye.